Hello, doctors and medical students. Welcome to our second podcast, and thank you for all the support. Our doctors community creating a lot of discussion, a lot of content on academic aspects, but we are lagging behind to create discussion and content on other aspects of life as a doctor in this society. That's what exactly we are going to do in this platform. If you are not following it till now, do it right now. We are going to learn a lot from this platform. In every episode, we are going to discuss one important topic which will be very useful for the doctors. In this regard, today we are going to discuss about medical certification. For that, today we are with none other than Dr. T.N. Ravishankar, one of the leading medico-legal expert in India.
Thank you.
Next one is disability certificates.
Disability certificate can be given only by that specialist. If it is going to be an orthopedic, only an orthopedic. Only if it is going to be an eye, it is going to be an ophthalmologist. If it is going to be any injury on the face, scar on the face, it has to be only by a plastic surgeon. Disability certificate has got two major components in it. It has to be given only by that specialty, and you are not supposed to charge for that certificate. These are two major things that is there in giving a disability certificate.
The next one is death certificate for home death.
Home death, I think today people are smart enough asking the doctor nearby to visit the person when they are alive, and then finally it's in form 4A, death at home, that has to be provided there. You are obliged to give it if you have treated the patient in the previous 7 days or 14 days until 14 days, and the event of death is according to the ailment that the person is suffering. Most often the 80 plus, you don't need to give a certificate. It is the duty of the village VAOs to provide it, getting a 10 people's signature and give it, but that doesn't happen anymore.
Yeah, it does happen.
It doesn't happen. 80 years plus VAO certificate is adequate, but then they always come to the doctor. There are times when medical councils have received complaints against doctors for having been part of a homicide that has happened at home with 80 plus. Murdering. Somebody does it. They come and say the patient died of respiratory distress, and you really think that was the event that has happened and had given a certificate. But finally, one other child would have given a complaint, and then they would have found out that the old man or the old woman had been smothered and dead, and you had given a certificate accidentally trusting the family that land up with the trouble. There are a number of cases of that instant that has happened in this country.
How to avoid that?
Be careful about it. You better go see the event that has happened. See whether there is any mark or anywhere and how the people react. Somebody who tries to cheat you or somebody who tries to mislead you always will leave a proof somewhere else. Look out for it. Be suspicious. Don't trust people at all the time, and that too when there is going to be a death in old age and also death at young age. Two things that has to be very carefully handled. It is always ideal to call all the children, ask them, or try to get a letter from them. We are convinced that the death has happened on this date of time and this place, and we are convinced it is a natural death. You can demand that letter from all the children if you are sure about the number of kids children are there for that legal hires are there. You can get a letter, official letter from them, and then provide them the death certificate really for the old age person. And when you are trying to give for a young person, be very, very careful, and that too newly married within the 8 years period when the husband or the spouse or whoever it is can be taken to task legally. Dowry harassment, physical violence, domestic violence can always be there, and be careful when you are trying to give a death certificate for one young person.
The next one is life certificate. You already mentioned that, but can ascertain it again.
Life certificate, assenter the person is that person. Always the company gives a form with the name always already written on it. Assenter, and today you have the other card to assenter whether the person is so and so. And make sure if you are trying, the person is not able to come to your clinic, make sure you go to their place and see. If it is not possible, at least on a virtual call, or your paramedical staffs can always go visit and finally find it out and give a video call and then talk to the person and then give a life certificate. It's very important that the person is alive on the day, and when you are trying to give a life certificate, make sure the time that the certificate is issued, the next 10 minutes, the next 10 hours, anything can happen for an old age person.
Next thing, the number of days. In leave certificates, is there any restriction for the number of days, maximum number of days for a doctor to give?
28 days. That's 4 weeks. Beyond 28 days, I think you have to reassess, or you can have to send to the board of medical examiners to get a certificate. Beyond 28 days.
Board of medical examiners meaning in the company?
In either the company has a board of examiners, or it has to go to a government hospital. They can apply to a government hospital. They want certificate for more than 28 days for an ailment, for a difficulty. Somebody is in coma. They say he might recover after 6 months. Then they have to go to a medical board. Medical board, get it a center, and then they will give a certificate that the person can be provided with another 3 months or 8 weeks or 12 weeks of leave availing depending on his recovery.
I actually came across some situations like one woman recently got pregnant, and she's working in IT industry. She's asking for certificate because that is her precious conception. She needs rest, so she cannot travel frequently. So she asked me for a certificate for 6 months. Is that possible to give a certificate like that?
It's a duty of the obstetrician who has taken care of her to provide that certificate. She only will know it's a precious child. She only know it is going to be a tough tiding over the nine months or whatever it is. She is one who is obliged to give that leave certificate for that pregnant woman. As a family physician or a practitioner, we are not obliged, and our certificate will not have that value. Maybe the company might take it easily, but if that has to be very precise, it is the obstetrician's role to provide that certificate.
And another thing, if a patient comes with discharge summary and all the treatment details, and he's treated by some other hospital or some other doctor, can another doctor give certificate for that patient?
Yes, of course. Assessing the whole situation. Somebody who has been treated elsewhere, it's in on the both situation, going back to work on a death certificate. Though you have not treated, but the sequence of event, maybe if you have seen the patient 7 days or 14 days, or they have come to you for consultation, then you can give the death certificate. Going back to work. All corporate hospitals may be in a different place, tier 2, tier 3 cities. In a tier 3 city, you would have gone to the tier 1 city to get a treatment, come back to tier 3. For getting back a fitness certificate, you may find it difficult to go back to the corporate hospital, the tier 1 city. In that situation, I think you ascertain the patient whether he is fit, recovered, he has got a discharge summary, the treatment provided to him, and the treatment he is on. You just try to ascertain whether the patient is really fit enough to go back to work, both mentally and physically, and then give them a certificate. There is no harm, and there is nothing legally preventing that individual to ascertain the patient whether he is fit and give a certificate.
In your experience, do you think there are certain gaps, and what are the gaps exist in medical education regarding medico-legal aspects?
Whatever we have talked in the last 30 minutes had not been taught for us in our forensic medicine. Our forensic medicine teaches us mainly on injuries, violating the criminal law of the society and all these things. But these are soft law, like soft communicative skills. These are soft law in the society that a practitioner should also be taught about it. I think the curriculum will keep changing. You just think it positively. The experience that we've gone through, our inputs to the concerned person, will always try to provide them. Though the National Medical Commission or the previous MCA has given certain appendix in their own thing of trying to giving a certificate, discharge summary or not, all these things. There are so many things that keep coming up in the society. When they thought about it, there was nothing about the working at home, all these things. COVID created the whole scenario of working at home, people demanding to stay back at home. There are times when people demanding to go back to work. Somebody is not allowing from doing work from home, somebody is disturbing you at home, they can't perform properly, they want to go back to the work, and all these things are there. Certificates, demands of the individual, demands of the citizens. I think the professional will have to keep changing. Change is one thing which doesn't get stopped. It keeps changing every point of time, and that change has to be adopted by our medical curriculum. I think they need to talk more, teach more, other than criminal law in the forensic medicine. There has to be a syllabus of communication to the society. The communication includes these kinds of documentation. Relationship in the society. These are two major things that has to be taught to the medical.
I think, sir, in internship we should. I believe during internship all these things should be taught. I think better they can have a subject for the theory class for interns regarding all how to survive
in the society, how to be a relationship in the society. That has to be taught. Soft skills again. It's another soft skill that has to be inculcated as a curriculum in your house urgency days.
So finally, do you remember any interesting stories regarding the doctors given medical certificate inappropriately and got into problems? Do you remember any stories like that?
You are asking the right person to do this answer. I was the one who was also involved in giving a death certificate for an young person who had died due to a threatened abortion by a mother. They came and told that the girl died because she had a seizure and all these things. And when I went and saw, there was a scar mark on the forehead, and that's an young person, 18 years old, of college student, and she died. And I gave a certificate that the person has got a seizure and a subdural hemorrhage or whatever it is. But finally, it turned out to be a forced abortion by the parent for having conceived in a college. There are so many things which cannot be told in the open. But then a postmortem was done, revealed that the petechial hemorrhages in the spleen, liver, the entire vaginal canal was packed with cotton plugs, probably bled to death, and during the end of bleeding, probably had a seizure, head injury, and all these things. I have gone through the whole issue, and I was not being taught in my college all these things, or probably I have missed it in the college. But then it was a real miracle and a surprise that the police officer who investigated the whole case gave me a clean sheet, but you had been accidentally taken into this case. And I was one of the accused initially, but then I was a witness in the case. Yes, I was an accused in the case. And then finally I had been the witness in the case, and the case went in favor of the family or whatever it is at the end stage. There was nothing to prove. It was a forced one. It was something like that. But it was an experience, a very, very bitter experience to have gone through it. If it had not been for that police officer who investigated so thoroughly and interrogated me for several hours to find out the real truth, I would not be sitting here to give an interview with you.
Actually, what they accused you of, sir?
I've been part of that whole episode of trying to do a illegal abortion, forced abortion, and the child died, and the girl child died. Naturally, this is why I said, keep saying, you need to verify the individual, put down the identity mark, verify, go to the place and verify. That was the time when I went and saw. When I went and saw, already the girl was within the garlands, and everybody was there around the girl, and I could see a forehead scar, which prompted me to write it as a subdural hemorrhage. But that was not the truth. The body was exhumed, sent for postmortem. They found it out. They packed cotton and all these things. It's an incident that has given me a lesson in my life, never to give a death certificate that easily. But then, and crossing over that trauma is very difficult, which should not happen to any medical practitioners.
Do you remember any of the stories, sir, like from outside, like from other doctors in your career?
Number of doctors had issued leave certificate and had landed up with problem with the companies. There are times when the medical commission has reprimanded them, called them and give them a warning, and there are times when there are doctors who had been banned or the temporary register number removed for 4 weeks and 6 weeks and all these things. There are quite a number of instances of that nature, and there are cases in the court giving a death certificate which was not a natural death. That's another incident. The family members himself involved. There was accusation, the court has intervened, a death certificate given, or having had taken a thumb impression when the person was lying in the bed in a hospital. They took the thumb impression. They said that the person was conscious, oriented and all these things, while the person was in hepatic encephalopathy, not knowing what is happening, but they took the thumb impression and the property was changed in the family members, and that resulted in a legal case, and finally the doctor had been suspended by the local medical council for almost a year. That's an incident that has happened.
Actually, what the doctor has done exactly, sir?
Used when the person was unconscious or in altered sensorium, lying in the ICU, they have taken a thumb impression of him in the documents.
Okay, sir. What is the role of doctor here, sir?
Person unconscious. Then while they gave a certificate, the person was conscious, oriented at the time when the thumb impression was taken. That is where the certificate is a fabricated or a false certificate attracting BNS 324 with imprisonment and fine also. There is another incident of a doctor involved in trying to remove the IV fluids that is going on for the old age person in an ICU, allowing the patient to collapse and die. These are two major incidents that will have to be seen in a very appropriate way. Though the second incident
looks like criminal.
Yes, the second case doesn't look like any certification involved. It was a criminal activity.
Yeah, okay.
In a hospital, the misuse of his position as a doctor, they gone near the doctor and tried to remove the IV line that was going is a resuscitation. One. The earlier case was trying to use the thumb impression, which is a very, very common sequence we always see in a movie or whatever it is.